Molindone Hcl is a medication used to treat certain mental and mood disorders, such as schizophrenia. It helps to improve clear thinking, reduce feelings of nervousness, and enables individuals to participate in everyday life. This medication can also decrease aggression, the desire to harm oneself or others, and may help to decrease hallucinations. Molindone Hcl is a type of psychiatric medication known as an antipsychotic, which works by helping to restore the balance of certain natural substances in the brain, such as dopamine. The daily dosage and the best time to take this medication should be discussed with your healthcare provider. When taking Molindone Hcl, it's important to follow your doctor's instructions. They will typically recommend taking this medication 1 to 4 times a day, with or without food. The dosage will depend on your medical condition and how you respond to the treatment. Your doctor may start you on a low dose to reduce the risk of side effects, then gradually increase it. It's important to be aware that Molindone tablets contain a small amount of calcium, which can interfere with the absorption of certain drugs, such as quinolone antibiotics, tetracycline antibiotics, levodopa, phenytoin, thyroid medications, and drugs for osteoporosis. Your doctor or pharmacist can advise you on how long to wait between doses and when to take your medications. To get the most benefit from this medication, take it at the same times each day and do not stop taking it without consulting your doctor. Stopping suddenly can worsen your condition, so your doctor may gradually reduce your dose. It may take several weeks to months to see the full benefit of this drug, so be patient and keep your doctor informed of any changes in your condition. Some common side effects of taking Molindone Hcl include drowsiness, dizziness, lightheadedness, constipation, dry mouth, and blurred vision. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist. Dizziness and lightheadedness can increase the risk of falling, so it's recommended to get up slowly when rising from a sitting or lying position. If you experience muscle spasm/stiffness, shaking, tremor, restlessness, mask-like expression of the face, drooling/trouble swallowing, or shuffling walk, it's important to contact your doctor right away. Your doctor may prescribe another medication to decrease these side effects. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks of potential side effects. However, it is important to notify your doctor immediately if you experience any serious side effects, such as depression/suicidal thoughts, fainting, difficulty urinating, signs of infection, symptoms of liver disease, severe stomach/abdominal pain, or unusual uncontrolled movements. In some cases, Molindone Hcl may increase the level of a certain chemical in the body, which could result in unwanted side effects. For females, this may include unwanted breast milk, missed/stopped periods, or difficulty becoming pregnant, while for males, it may result in decreased sexual ability, inability to produce sperm, or enlarged breasts. It's important to inform your doctor if you experience any of these symptoms. Rarely, males may experience a painful or prolonged erection lasting 4 or more hours while taking Molindone Hcl. If this occurs, it's important to stop using the medication and seek medical help immediately. It is also important to seek medical help right away if you experience any very serious side effects, such as seizures or symptoms of a serious condition called neuroleptic malignant syndrome, NMS, including fever, muscle stiffness/pain/tenderness/weakness, severe tiredness, severe confusion, sweating, fast/irregular heartbeat, dark urine, or signs of kidney problems. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed above, it's important to contact your doctor or pharmacist. In older adults with dementia, there is a slightly increased risk of serious, possibly fatal side effects such as heart failure, fast/irregular heartbeat, and pneumonia when using Molindone Hcl. It is important to note that this medication is not approved for the treatment of dementia-related behavior problems. It is crucial to discuss the risks and benefits of using this medication with a doctor, as well as explore other effective and possibly safer treatments for dementia-related behavior problems. Before taking Molindone Hcl, it's important to let your doctor or pharmacist know about any allergies you may have or if you have any medical history of blood problems, eye conditions, heart problems, slow movement of the gut/intestines, liver disease, brain disorders, drug/alcohol/substance abuse, breast cancer, Parkinson's disease, or difficulty urinating. This medication may cause dizziness, drowsiness, or blurred vision, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you know how this drug affects you. It's also important to inform your doctor about all the products you use before having surgery. In hot weather, be cautious of overheating and seek medical help if you experience any symptoms of heat stroke. Older adults may be more sensitive to the side effects of this drug, and it should be used cautiously during pregnancy and breastfeeding. If you have any concerns or are planning pregnancy, speak with your doctor about the benefits and risks of using this medication. When taking Molindone Hcl, it's important to be aware of any potential interactions with other drugs. These interactions can affect how well your medication works and may even increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Before making any changes to your medication dosage, always consult with your doctor first. If you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines, be sure to inform your doctor or pharmacist. Additionally, check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. It's always best to ask your pharmacist about using these products safely. As always, it's important to follow your doctor's recommendations and guidance when taking Molindone Hcl to ensure the best possible results. If someone has taken too much Molindone Hcl and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help by calling 911. Otherwise, contacting a poison control center is necessary. In the U.S., residents can call their local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include slow or shallow breathing and being unable to wake up, which may lead to a coma. It's important to note that you should not share this medication with others. Your healthcare provider may also conduct lab or medical tests while you are taking this medication, so be sure to keep all medical and lab appointments. This is crucial for monitoring your progress and ensuring the medication is working effectively for you. If you forget to take a dose of Molindone Hcl, take it as soon as you remember. However, if it's almost time for your next dose, then it's better to skip the missed one. Don't take double doses to make up for the missed one. Stick to your regular dosing schedule. It's important to store Molindone Hcl at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When you no longer need the medication or it has expired, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.